Good day and welcome to Healthcare Policy and the 2012 election. While the economy remains the dominant issue this campaign season, healthcare is another top concern among voters. Today we'll take a closer look at the presidential candidates' healthcare proposals and how those ideas are influencing the race to control the White House and Congress. First, a conversation with well-known policy analysts, and then a journalist roundtable. Former Senate Majority Leader Tom Daschle was a key behind-the-scenes player in passage of the healthcare overhaul law and remains one of its most vocal defenders. Senator Daschle is now a senior policy advisor at DLA Piper. Avik Roy is a senior fellow at the Manhattan Institute, a conservative think tank, and he writes a healthcare policy blog for Forbes. He is an outside healthcare advisor to the Romney campaign. Joining me in the questioning is Karen Tumulty, national political correspondent for the Washington Post. Thank you all so much for being here. As we were just discussing, there wasn't a lot of health care in last night's debate, but did you hear anything that you think moved the needle?
Yeah, I mean, so one of the things that Romney brought up in one of his discussions was the point about Senator Obama's promise that premiums would go down, or health costs would go down for every family or average family in the United States by $2,500 per year. And in fact, premiums have gone up by that amount since the Affordable Care Act was passed. And I think the issue of the rising cost of health premiums is a big part of the challenge that we all face and we all talk about in health policy, and certainly something that we should continue to talk about in terms of comparing what the Affordable Care Act would do and what Governor Romney's plan would try to achieve as well.
Although the law has not been implemented, actually, so the forces that would, none of the forces that they argue would drive costs down have really taken effect yet.
Sure, but the insurers are anticipating a lot of the mandates and regulations coming into force, and that's one of the reasons why premiums continue to increase as people try to lock in certain cost increases, both providers and payers, before those provisions come into place.
Let's talk a little bit about pre-existing medical conditions. As we know, the Affordable Care Act, as of 2014, you cannot deny coverage based on a pre-existing medical condition. And Governor Romney has a plan on pre-existing medical conditions. He says he has a plan. Could you please explain what that is, and is it as comprehensive as what's in the Affordable Care Act?
Yeah, so first we need to step back and understand who are the uninsured in America. And if you look at the uninsured in America, the vast majority of people who don't have insurance in America, it's because insurance is too expensive. It's not because they can't get insurance. There is a small percentage, an important population of people, but it's a small percentage of people who today don't have protections in terms of being able to get insurance regardless of pre-existing conditions, because there are a lot of people who can, right? So if you're in the small group market, you can get, you have guaranteed issue in the small group market. Where we don't have guaranteed issue is in the non-group market, which a small fraction of Americans participate in. So, and why is it? Why is it that there are people out there who can't get insurance because of a pre-existing condition? It goes back to this quirk in the tax code from World War II, whereby employers sponsor insurance and get a huge tax subsidy for doing so. And as a result, there's a lot of efficiencies that come out of that. One is that health insurance is more expensive. And the other is that because employment is tied to insurance, when people lose their job or switch their jobs, they have gaps in coverage. So that's what creates the pre-existing condition problem. So we have to understand first what's causing the pre-existing conditions problem in the first place. So there are two ways to address it. One is to do what the Affordable Care Act does, which is create another sort of policy patch on top of that, which then requires the individual mandate, subsidies for lower income individuals, and all the other mechanisms to ensure that if you're going to have guaranteed issue for everybody, you're going to do all the other things. And that's what creates the Affordable Care Act to a large degree. The Romney approach is to say, let's address the original problem. The original problem is that people don't own their own insurance and can't take it from job to job. They can to a degree. HIPAA, which the senator was involved in shepherding through Congress, is an important advance in that regard. But there are still other things you can do to expand HIPAA protections to people who have credible coverage. And then for people who still have those gaps, do more with high-risk pools and do other things to make sure that the people who can't get insurance today have the ability to get it through subsidized high-risk pools at the state level.
Is that enough, Senator Daschle?
Unfortunately, no. It's all about actuarial calculation and actuarial viability. And you can't get to actuarial viability to cover all of those. And I would differ slightly. It's not a small percentage. We're talking about 50 million people that don't have insurance and another 40 million people who are very underinsured in this country. Nearly 100 million people, and they're all under the age of 65. So it's a fairly significant portion of the population. And the problem we have today is that because of the actuarial calculations that all insurance companies, with the business models that they're forced to use, consider as they try to determine the degree to which they can make insurance affordable to those who have pre-existing conditions. It simply doesn't calculate without everybody participating. Now, everybody does participate today, but in the most inefficient way. We already have a mandate, and the mandate is the one that requires uncompensated care to be provided, and we all pay for the cost of uncompensated care added to our bill, mandated to our bill, if you will, at the time when we pay our bills to the doctor in the hospital. So what the Affordable Care Act tries to do is to put in place an opportunity to create a new actuarial model that relies on universal participation, that allows then the actuarial balance to come back to what it needs to be to allow the insurance companies to comfortably cover all of those with pre-existing conditions today. That's what it does. And as Karen so correctly points out, we don't really have that model in place yet. It doesn't really kick in until 2014. The states are going to have a year to put in place exchanges that will allow us the opportunity to create these insurance levels at different actuarial values, but that won't begin for another year and a half.
So the Congressional Budget Office did a study that analyzed this question of why are people uninsured. And 71% of the people who were uninsured over a long period of time were uninsured because of the cost of insurance. Only 3% were uninsured because of their health status. They couldn't get insurance because they were ill. So it is it's an important population. It's in a big country like ours. You know, if under 1% of people have this problem, that's still 1 to 3 million people. So it's still an important problem for us to understand. But we have to make sure that whatever the solution is doesn't drive up the cost of insurance for the other 99% of the population. And that's part of the challenge with the Affordable Care Act, is it doesn't do enough. In fact, it goes in the other direction in terms of driving up the cost of health insurance for the vast majority of people who have it already.
I must say, I'm not familiar with that study, but it just defies credibility. It would seem to me that, you look at the obesity problem in this country, you look at the type 2 diabetes problem we have in this country, you look at the coronary and other chronic illness problems we have in this country, and I know just statistically and demographically, it's more than 3% of the population. So I want to go back and look at that study. But I have to say, regardless of what the percentage, the problem is still there. It's one of actuarial accountability and actuarial balance, and the only way you get there is with a mandate.
Could I get a couple of scenarios out here and sort of, if you could sort of play it out for us, what the next couple of years would look like? Suppose Mitt Romney wins the presidency, but it is almost certain the Republicans are somewhere short of 60 votes in the Senate, whether they're in a small minority or a small majority. President Romney says he would repeal Obamacare. How far could he get in this sort of situation? I mean, he could use the reconciliation process to some degree, but how much of this bill would be dismantled?
Well, I would say that the bulk of it can be dismantled. If a president is determined to do it, he can do three things. First of all, he can pass legislation. As you say, he can use reconciliation for certain amounts affecting the budget of the federal government, and that's calculated to be somewhere in the 40 to 60% range, depending on how parliamentarians ultimately rule on some of these budgetary questions. So that's number one. Number two, through rulemaking, he can really do a lot to change the course of the legislation, because especially with the Affordable Care Act, the Secretary and the President were given wide latitude. And third, he can defund it. He can just simply not dedicate resources within the budget. That will be his prerogative as he sets his own budget. So he could have a profound effect on the outcome of the ACA in a very short period of time.
What do you think would be the reaction to that? Let's say, to Karen's point, the thought is perhaps Republicans keep the House, Democrats keep the Senate. How does Congress respond under that scenario?
Well, I think if you make the assumption that it will be a status quo election and the houses remain the same, where the Senate is still governed by a Democratic majority and the House the Republicans, there really isn't a lot they can do. They wouldn't have the consensus that it would take to override a veto or to press legislation that the president could sign. So it is most likely that you would see a significant stalemate. Now, that said, I think there's sort of an inexorable momentum that is going on as I look at the health sector all over the country. I mean, there are just things that are happening out there that on payment reform, on delivery reform, on insurance reform, that are not reliant necessarily on the ACA. So I think you'll still see movement. We're in a very transformational time, but nothing like the definition that the ACA provides this movement today.
Avik, how do you see this playing out, or this scenario concept?
Well, I'll certainly defer to the Senator's expertise about reconciliation. I mean, I would agree that in general, the point of reconciliation is you can use reconciliation to pass legislation that is germane to the budget, and clearly the ACA is germane to the budget. And a piece of repeal legislation would theoretically be simpler. It's not like you have to pass every provision, every section of the ACA, or repeal each section one by one. You could repeal them in chunks, which makes it more germane to the deficit. So in that sense, reconciliation is easier to use with repeal than it is with passing the original bill. In terms of what would happen if the Democrats control the Senate, I think it's pretty unpredictable. I can say certainly I don't know if conservatives, grassroots conservatives, or congressional Republicans have articulated what they would want to do in that setting. I think that what Governor Romney has stated is that if he doesn't have a Senate majority, what he would certainly do is he would try to assign waivers to the states to liberate states from implementing as much of the law as he would have the legal authority to do. So he would use executive orders to limit the implementation of the law. But aside from that, I think a lot of people would have to do some hard thinking about where they could work with the other side.
Well, okay, the other alternative, say President Obama is reelected. We're coming up on 2014. He's got to sort of put the key in the ignition and turn it and see if the car engine turns over here. If you were Secretary of HHS and you look out across the map and you have all these states in various degrees of preparedness for this, various degrees of eagerness to do this, what would be keeping you awake at night?
Well, I think the degree to which there are deadlines in the legislation that I think could be a challenge to meet in some cases with the states currently in the position they are. So I think what would keep me up in part would be, number one, could we meet those deadlines? I think the president would probably use the authority that he has to intervene and to set up, in many cases, a federal exchange or a federal system to accommodate those states that are simply farther behind. But I think more than that, what keeps me up mostly would be the larger budget about health as we go into the fiscal cliff decisions and all of the other huge legislative challenges the President and the Congress will be facing. What will happen to Medicare? What will happen to Medicaid? What will happen to the funding of the implementation of ACA with the backdrop that we're going to be facing beginning almost immediately around the budget and the fiscal cliff?
What do you think?
Oh, I think that's absolutely right. I think that the broader fiscal picture, particularly with the lame duck session coming up, but even afterwards, health spending continues to be the dominant growth driver of federal spending in general. And regardless of what happens with the Affordable Care Act, regardless of what happens with Governor Romney's approach to Medicare reform, these problems are not going to go away. And so it's going to be a challenge, and it's going to be something that both sides are going to have to come together on. And I think that's one of the things that is really important here, is that there's not going to be an ideological victory on this stuff. You really have to find people on both sides who are willing to work together to come up with a solution.
And plus you have a lot of governors, even Democratic governors, who are pretty skeptical that they can make even with the federal match on the Medicaid, that they can make these numbers work. Is that a valid concern?
Well, I think first of all, this is as good a deal as governors are ever going to get in terms of the adequate funding for the expansion. But I think that every executive, every chief executive, whether it's state or federal, is going to be facing a lot of these budgetary challenges with a degree of anxiety, with a degree of frustration, because they know the clock is ticking and the calendar pages are turning, and they just don't have a lot of time. So time and budget and overall yearning for some degree of consensus on some of these things is going to be very high.
Well, Medicare is off, it will be a part of the discussion next year on the budget. It's also a big part of the campaign, so lots of discussion about premium support, about Governor Romney and Congressman Ryan's proposal on premium support. How do they assure the American public that the amount of money that they will dedicate in premium support to allow a senior to either buy traditional Medicare or a private health insurance plan, that will be enough. And it will rise enough with the increase in healthcare costs that seniors don't have to go digging into their pockets to get the coverage that they choose.
So this is the whole reason why the plan was designed the way it was. So you may remember about a year ago in the Republican primaries, all the candidates kept getting asked, do you support the Ryan plan? Do you support the Ryan plan? And what Governor Romney said was, I support the broad principle of entitlement reform, but I'm going to come up with my own plan. And everyone was like, well, what does that mean? But eventually he rolled out his plan. And what was his plan? His plan responded to just that criticism. It said, we are going to bring up the level of premium support in every market so that it matches what would be necessary to cover all the traditional Medicare benefits that are covered today. And what you do is you have a bunch of insurers, including the traditional government-run Medicare fee-for-service option, compete. And whoever has the second lowest bid of the group, that would be the level of the subsidy. But that level of subsidy would mean that every senior would be guaranteed coverage with the exact same benefits they have today. So the whole reason he went to that system, and there's no cap in Governor Romney's approach. There's no, so for example, with both the old Ryan approach with President Obama's budget, there's this cap of Medicare can only grow at a certain amount. You know, the ACA also has a growth rate that's
GDP plus a half
GDP plus a half percent, exactly.
Okay,
so Governor Romney's plan doesn't have that kind of a growth cap. Basically, the approach of Governor Romney is let's let competition do the work and not arbitrarily put a global budget cap on the way we adjust these payments. So there's a 100% ironclad guarantee that the payments will cover the benefits. It may be that in certain markets, like the study you've shown that the Kaiser Family Foundation has recently published, that the FFS, traditional government-run option, is cheaper. In other markets, it may be that private insurers are cheaper. But seniors would have the choice to choose whatever the plan they want, and they would have the ability to select the plan that was best for them, and if they wanted to pay more for a more generous plan, they could do that.
Senator Daschle?
Well, I think it'll work about as well as the SGR has worked over the last 13 years.
Sustainable growth rate that pays
Sustainable
doctors
growth
and
rate,
Medicare.
yeah. We paid doctors, and they were given all the assurances, and I must say I was part of that in the early years and feel very badly that we didn't do a better job of addressing many of the concerns raised at the time. But I think there are two choices that legislators have. They can either cut and shift, or they can redesign and improve these programs. Cutting and shifting doesn't solve the problem. It simply exacerbates them by passing on the responsibilities to others, including the beneficiaries. I'd much rather address the core issues that we face in addressing cost effectiveness in a lot more comprehensive way than by cutting and shifting. But that's really what we're doing. We're putting older people into the individual market, which the CBO has said is a lot more of an expensive approach to use. First, because administrative costs are so much higher. Secondly, because you've got a lot more involvement in the part of a lot more organizations where the coordination of that coverage becomes a lot more complicated. You know, we already give seniors the choice as they have an opportunity to sign up for Medicare Advantage. So to take it beyond that with a new voucher program in the individual market, the most expensive marketplace in healthcare in the country today, is not an example of cut and shift that I think the majority of members of Congress can support or will support.
I completely agree with that dichotomy between cutting and shifting versus structural reforms that improve the efficiency of the program. But I would contend that it's the Affordable Care Act that does the cutting and shifting. It cuts provider payments by $450 billion, which will drive a lot of providers out of business. And what you'd rather do instead is let seniors have control of their own health dollars and buy plans that are more efficient. There's a lot of literature that's come out the last couple of months that's shown that Medicare Advantage plans with the same level of benefits is more cost efficient than traditional fee-for-service. So why not give seniors the option to have the same benefits at a lower cost?
But you don't buy the argument that healthier seniors will in fact go out and do that, but that will leave sicker and seniors back in traditional Medicare and make it more expensive for the government?
So what you do is you have a risk adjustment program to ensure that insurers aren't engaging in risk selection. This is what we do with the Medicare Advantage program. This is what we do with Medicare Part D. This is what we do in the Federal Employee Health Benefits program that all members of Congress belong to. It's a relatively routine process, and there are critiques of how you can tweak or improve risk adjustment, but we know a lot about risk adjustment, and we can use it to work in this situation.
Well, you can't do it actuarially. First of all, you can't tell somebody they can't leave the system, but you're going to see this natural evolution away, and the healthy people are. You know, the other thing I think about is my mother, 89 years old, and not a clue about how all this works. To pit my mother against the marketplace, and I might say even I think I know a little bit about this, but the lack of transparency, the fact that we really don't have a market. The health sector is the only place in the country, the only sector of the economy that at the time of purchase, we don't know what it's going to cost or who's going to pay. And we have a lot more statistics on every sports figure than we do on any provider or any institution today. So the lack of transparency does not allow for the market forces that would work in other settings to work here. They just don't work. And so I think we've really got to be sensitive to the needs of my mother, to the needs of those who understand that in an individual market, to put an 89-year-old woman into that setting and expect her to make the best decision is just not doable.
But looking ahead to we're getting near the end of this campaign. We have another debate coming, and the debate in the election will be here soon. How critical is health care in this campaign? And what do the candidates need to say to lock down the voters' vote, for voters on health care? What is the critical message they need to get out there in the next few weeks?
Well, I would certainly say Governor Romney is first and foremost focused on the economy. He's concerned about the state of the economy today, and he wants to improve it. And so to the degree that there's the focus of the healthcare message is primarily around what the ACA does to retard economic growth, what it does to retard hiring, what it does to our fiscal situation. And so it's really about the economy at the end of the day and how the ACA feeds into that.
Well, Winston Churchill said it best. He said once that a lie gets halfway around the world before the truth gets its shoes on. And that was never more clear than in the debate about health care. There have been so many mistruths and misinformation that I think the best thing the president can do is contribute to helping to clarify just what it does and what it doesn't do. What I take a great solace in is the knowledge that the more people know, the more they like. They like the protections that they've already been given. They're going to like when they find out that they're covered by on all 10 categories of essential care with new insurance plans that they're not eligible for today. They're going to like the subsidies they get to help pay down the premiums. They're going to like the new paradigm once it's built with greater transparency. But today, there's just so much confusion in large measure because there have been so many lies.
And Karen, you're so closely following the campaign, reporting on it. How do you see healthcare shaping the campaign as it continues?
Well, one thing I've been struck with, and tell me, Senator Daschle, if this is your sense too, I think President Obama has become much more aggressive about framing healthcare as an economic issue. And I do think we heard a little bit more of that in the debate last night too. And is your sense that they missed the boat on this at the beginning? Are they trying to make up for some lost ground?
Well, the president had a lot on his plate, and I give him that. One of the mistakes that I think we made when we passed Part D, the drug bill, we passed an education and promotion account that allowed us to actually hire people like Bob Dole, a very dear friend of mine, to go out and articulate to the senior population just what it did and how good it was. As one of the last-minute decisions we made to bring down the cost, we took all that money out of the budget for the Affordable Care Act. So we really had no way by which to do what we did with Part D, to educate, to promote. And I think there was health fatigue after all of the tremendous work to get the job done. People just said, look, enough already. Let's move on to other things. I'm tired of talking about it. But it was a mistake. I think we did well with implementation so far. I think we've done well in putting the new paradigm in place, but I think we did poorly at messaging.
How much of this is getting through to voters? We're in Washington. We live and breathe a debate over premium support or Medicaid block grants or pre-existing conditions. What's getting through? And what isn't?
I would say that there has been a lot of misinformation about healthcare. There always is, and that's true on both sides. So a lot of the talk around throwing grannies off a cliff is misinformation as well, right? And the irony is that premium support is not just something that's used in the Romney-Ryan plan for Medicare reform. It's used in the ACA exchanges. The ACA exchanges have premium subsidies that are tax credits benefits that grow at a certain rate that may not keep up with the cost of healthcare inflation. So these are ideas that a lot of people try to adapt to their healthcare reform bills, and maybe that's where some sort of bipartisan approach can come through. But I think that at the end of the day, one of the things that people are really concerned about is the cost of health insurance premiums. And unfortunately, the ACA doesn't do enough. If in fact it goes in the other direction. Jonathan Gruber, one of President Obama's advisors, has issued reports to states saying that in Wisconsin, premiums in the non-group market will go up by 30%, in Colorado by 19%, because of the regulations and mandates that the law is imposing on insurers. So that's something that a lot of people are rightly concerned about. Health premiums keep going up. They eat up a larger and larger percentage of wages, and that has economic effects. And I think that's something we don't talk about enough when we talk about health reform.
I'd like to weigh in quickly.
Well, I agree with much of what was said. I think that, number one, we know we're going to spend $35 trillion on health in the country in the next 10 years, and that we can't sustain that indefinitely. That what we're going to have to do is to bend the cost curve, to bring in place mechanisms, and we know where we're going to have to look. We have to look at transparency. We have to look at coordinating chronic illness. We have to look at getting rid of fee-for-service or finding alternatives in large settings that would allow us to deal with the volume-driven approach we have today. We have to deal with fraud and abuse. We have to deal with administrative costs. The ACA puts on the field an opportunity for us to do that for the first time. Does it solve it all? No. Could it have gone farther? Absolutely. I strongly support IPAB, and I know we could have a big debate about that, but we won't today. But it puts in place mechanisms to allow us to address the real causes. It redesigns and improves, which is what I said at the beginning was what we needed to do to make a difference in health costs in the future.
All right, well, I'm going to leave it there. Thank you so much. Tom Daschle,
My pleasure.
Avik Roy, and Karen and I will be back in a moment with our Journalist Roundtable.